Hi everybody, it's Helen Birch here. In today's video, I'm going to be discussing male sexual dysfunctions, and in particular, two sexual dysfunctions that I see increasingly with my clients. For those people who don't know, I am Helen Birch, a clinical hypnotherapist, sex therapist, and sexual freedom practitioner. So, first of all, I just want to discuss general penis issues. And it's the common perception of erectile dysfunction is that it prevents one from getting hard. However, I have discovered that there are four main areas where guys struggle, and this has come about with working with real clients. So these include not being able to get hard, getting hard but losing the erection during sex, orgasming too soon, or being too slow to orgasm. So those are the four main things. Additionally, being completely incapable of orgasming. But today I'm going to examine the first two problems in this video, and I'll outline some of the key causes for why they are affecting an increasing number of guys and what you may do to alleviate, if not completely resolve, those problems. So the first problem is not becoming hard or remaining hard. When you are with a sexual partner, some males find it difficult to get hard, while other men can get hard but then lose their erection, which may or may not return during the session. There are several common reasons why this happens, and this includes general performance anxiety, dependence on porn, bad sexual encounters in the past, challenges with confidence or having low self-esteem, erectile dysfunction triggered by condoms. No matter when or where it occurs, the moment we begin to worry about getting erections, we become stressed. We then go round and round in this cycle, and the more we tense up, the harder it is to get hard, and the harder it is to get hard, the more worried we are about getting hard. Getting an erection is an automatic process that is triggered by sexual actions or something our mind misinterprets with sexual activity. For example, bouncing up and down or rubbing yourself against something. So our subconscious mind handles automatic functions like breathing, regulating our body temperature, and hardening and getting erections. And this is an incredibly potent portion of our minds. And in actuality, a mind that is as powerful as the subconscious mind can process around 20 million pieces of data in a second. On the other hand, just about 40 bits of information are processed by our conscious mind. And this conscious mind is a part of our brain that we are using for awareness. And it's the bit that allows us to talk and consciously think about things. It's incredibly easy for all this processing capacity in our conscious brains to be consumed by just one thing because of this lower processing capability, which is one reason why we can become fixated on certain concepts or fixated on the idea of losing our erection. Additionally, if that one thing isn't beneficial, it could be seriously harmful, such as prohibiting us from having erections. It frequently is described as becoming fixated on a concept or even as getting in our heads about something. And many clients come to me saying that they just want to get out of their heads and back into their bodies when they are having sex. When this occurs in relations to erection, it can be difficult to interrupt the cycle. And if the issue is not resolved correctly, having trouble getting or keeping an erection may persist for the rest of one's life. The second issue is not getting hard or staying hard. And the standard solution for this is Many guys or males will turn to pills trying to resolve this issue. Since doctors and medical experts generally follow the medical model, which dictates that medications are usually the first course of action, then this is frequently the answer that they advise when you go to see your doctor. However, there are a number of drawbacks, with cost being one of them. And erectile dysfunction medication, such as Viagra, can cost up to £3 a pill. So even if you get them from the doctor, then there will still be a cost for your time and prescriptions. Viagra recently became non-prescription in the UK. However, it cost £5 a pill in UK pharmacies. Additionally, you have to remember to take the tablet, and it normally takes around 30 minutes for it to start working. They can also have the following side effects. So Viagra can cause flushing, which is warmth or redness and tingly feeling within the body and skin. It can cause headaches during or after use. It can cause dizziness, abnormal vision, such as blurred vision or red eyes. It can also cause a runny or stuffy nose because it's causing the blood vessels to expand. It can cause nosebleeds and sleep problems, muscle pains such as back pain, and it can also cause an upset stomach. This form of treatment can work for many people, but it does generally mean that you are choosing to rely on pills for the rest of your sexually active life, which is not ideal. So, what is a holistic approach to treating erectile dysfunction? Re-education and homework. So many guys turn to the pills or drugs when they're trying to resolve this issue. Despite its immense power, our subconscious mind's first goal is to keep us alive. And unfortunately, in doing so, it can sometimes get in the way of our progress. Our subconscious mind encourages us to continue performing an action if we have been doing it for a while and we haven't died, because all our subconscious mind wants to do is keep us alive. So, for example, have you ever questioned why smokers continue to smoke despite seeing gruesome pictures and warnings on every cigarette packet? Well, this is because, as far as their subconscious is concerned, they have been smoking for many years and they are still alive. So the subconscious mind wants to keep it that way. And so it does this by reinforcing your smoking habits. This is why if you do not get your subconscious mind on side when quitting smoking, it can be very hard to manage to stop in the long term. Thankfully, there are techniques for engaging the subconscious mind, and using affirmations is one of them. So we can begin the process of convincing our subconscious that things need to change by repeating our intentions multiple times a day. So just a little explanation of how you can use affirmations. So the affirmation, you are a confident man and you get hard when needed. Use this affirmation for at least once a month. Recite the series of affirmations twice daily, usually in the morning and the night. While doing that, say it aloud 3 times. So say the affirmation out loud 3 times, and saying it out loud firmly, sincerely, and with feeling. And also remember to say you instead of I, because your conscious mind has a horrible habit of disputing what you just said. So it will become confused between you and I. So remember to use you when talking about yourself. You can come up with whatever affirmation you think is appropriate, but the one above seems to be the one that resonates best with most clients. So you can become hard whenever you need. When I work with clients, I use hypnosis to focus the client's attention on their affirmations and insist those words to go deeply into the subconscious mind. This process works in such a way that it is able to bypass the conscious mind, and it allows me to have the clients use the word I I am a confident man. And these words go deep and go right down and get to work straight away. Another way is to change the language or reframe what you're saying. So first, you'll see that the affirmation advises to become hard when necessary. And the majority of us are accustomed to porn where the actors seem to remain hard forever. We're not really made to be hard for a very long time, but I'll get on to the significant impact of porn in a moment. Around 200,000 years ago, when humans first began to evolve and have and enjoy sex, there were many animals that would gladly hunt and kill us given the opportunity. In order to reduce the likelihood of ultimate death, humans were created to become hard, have sex, and orgasm swiftly. In light of this, continuing to work and stay hard for a long sex session isn't really what we're made to do. Now, I'm not suggesting that you do short sessions. Rather, I'm saying that you will have a better experience if you can grow used to the idea of being firm mixed in with being soft or semi throughout a long session. So the idea is that you are not hard throughout the whole session, because your natural state is to be hard and soft throughout a sex session. In oral sex, for instance, it doesn't really matter if you're hard or soft, but it is ideal to get erect when you first start sexual contact, such as kissing or stroking. Due to your continued relaxation regarding your erection, there is a greater likelihood then that you will be hard once more as you go back to kissing, because you are associating kissing with being relaxed and hard. Avoid letting the person that you're with try to keep getting you hard. This is because it can just knock your confidence. It can be hugely damaging to have someone trying to get you hard and have nothing happen. Instead, it's better to pull away from that person, talk to them, and move your thoughts back into the moment and back into the present situation. Things such as noticing what they feel like, what they smell like, how does that kissing make you feel? All those things can bring you back into the moment with your partner or even with yourself. This is then when you become more relaxed, because you stimulate yourself to bring your attention back to your penis and then allow the blood to flow back in because you are relaxed and calm once again. You can do this on repeat, get hard, have your erection go away when it's not needed, focus back on foreplay, get the blood flowing again for as long as you want to enjoy the session without panicking or worrying. So talking to the subconscious, getting an erection is a response to sexual stimulation, and it should be an automatic process because, as I have previously talked about, the subconscious mind governs these functions. I use hypnosis on clients while they are calm to direct the incredibly powerful subconscious mind towards getting an erection, sending that idea back to the subconscious part of the mind where it belongs, so it becomes an automatic process again. It's crucial to make sure that the subconscious recognises sexual stimulation as a trigger to give a person a strong erection. Similar to how our subconscious is aware that when our bodies require oxygen, it makes us want to breathe. It's an automatic process that we don't think about. Imagination over porn. So numerous studies on the negative impacts of porn have been conducted, particularly over the past 10 years. And although porn has its place, I can definitely see how porn has affected males over the years. I don't think it's something that we should get rid of. I don't think we should be completely eliminating porn, but we do need to retrain ourselves to use it in moderation. One of the fundamental problems with porn is that it raises false expectations for sex. Not to mention that a single scene can be filmed over the course of several days with the actors having breaks, having rest, changing of light in, and other preparations to make sure everything in that porn scene looks flawless. The fact that porn kills our imagination is, in my opinion, its worst drawback. There was formerly this notion of a mental show reel, and the notion was that we could revisit and reimagine our best sexual encounters and use them as a reference for future sexual experiences or when we want to get aroused or excited. Also, we previously had to conjure up our dreams and imaginations because there wasn't a ton of porn available. And it's not ideal when attempting to get hard, stay hard, and enjoy sex when we watch too much porn, because everything sex related that isn't porn then becomes just not as good as porn. So that then means that our imagination is not as good and doesn't become as good associated with the porn that you're watching. So how can you fix this and get your imagination backfiring? So I do suggest a porn fast, which is basically to use your imagination to masturbate for 30 days without the use of any pornography at all. You could masturbate as much as you normally would, even more if you feel like it. And then porn can be reintroduced after 30 days. Otherwise, we wouldn't watch it as frequently. However, you need to be sure that only one of your 3 masturbation sessions uses porn material. So what I mean by that is every third time that you masturbate, make sure that you are only using porn then, and the other 2 times you really want to be using your imagination, recalling past events and experiences. So the next thing I want to discuss is anchors and triggers. So anchors are fascinating things, and they are totally normal activities that occur throughout our life. If we repeat an action many times and follow it by another action, the first action can then cause the second action. After a few repetitions, for example, in Pavlova's dog, the dog anchored the idea of food onto the bell and began to produce saliva on hearing the bell alone without any food being present. And Pavlova introduced a stimulus, for example, the sound of a ringing bell, and then offered the dog food. This was anchoring and triggering. So there are numerous methods that humans can use to accomplish this. And it's very typical, for example, to associate joyful memories with a certain song. And when the music is played, that happy memory is immediately brought back, transporting us back to that original event. The most helpful thing that I can do in therapy sessions is to set up an anchor that my clients can use later. So in the case of psychosexual treatment, I can anchor the feelings of fantastic, successful sexual experiences, and this can subsequently be reactivated before any future sexual encounters to generate the correct mood. I can also utilise this technique to increase self-esteem and to boost confidence. Interestingly, many sportsmen and person employ this approach. They have anchors for winning events, frequently tied to a spot of colour on their sporting equipment, and when they see that colour, it evokes that winning emotion and helps them to victory. Another suggestion is the 5-to-1, which is a mindful technique. So you have probably heard the word mindfulness, which is basically just a fancy way of saying staying in the moment and being present. And it's crucial to stay present while having sex. If nothing else, it will make your experience more enjoyable. But if your mind becomes fixed on one thought of not getting hard or remaining hard, then this is when mindfulness and staying present can really help. So, for example, simply counting down from 5 to 1 is one of the most simplest methods to bring your attention back to the present. Simply count down naturally from 5 to 1 right now and just see how your mind begins to clear and change. When you and your spouse are together and the first anxious thought arises, count to 10 and shift your attention to what is happening right in front of you. Kissing is really significant because it releases a variety of good feel hormones into our body. And also, as previously discussed in the video, you should also consider how the person feels, how they smell, how they might taste, all of which is bringing you back into the present moment and getting you out of your head. So in hypnotherapy, we use a technique called future pacing. And this technique is employed by many sports persons called mental rehearsal. This method involves repeatedly practicing an event in our brains, such as winning an event or flawlessly carrying out an activity. Our subconscious does not distinguish between real events and things that we have only imagined. There are several reasons why this is not helpful, which I will discuss in a future video if anyone would like. However, it is helpful when it comes to mental rehearsal because when we repeatedly practice a task, our subconscious feels we can do it. And then when the actual event occurs, it is there to support us. I can go one step further in the treatment room and employ a technique called future pacing. And this is a technique that uses hypnosis to help you visualize or envision being in the future where you are actually having a successful sexual encounter. The encounter can go perfectly and you get to stay hard and erect and feel all those emotions of this amazing encounter. In your conscious mind, it's easy enough to imagine because it's something that might happen in the future once the therapy sessions have done their work. Plus, your subconscious mind actually believes it has happened because remember, it doesn't know the difference between real or imagined. So it's win-win for both parts of the brain. I just want to discuss condom-triggered ED. So it is a sad fact that there is a good probability we would have less teen pregnancies and STIs if parents offered their teenagers, particularly boys, condoms and urged them to enjoy masturbation with those condoms. Why? Because if you observe what we do in place, teenagers are advised to use condoms at all times because failing to do so puts them at risk of getting into serious trouble. When you tell a teenager what they must do, especially when it has such frightening implications, it seldom goes well. This then establishes condoms as a mental anchor in their minds. Anchors can be anything, such as a song that brings back pleasant memories when it is played, or an unexpected aroma that makes you think of your grandma, or your penis turning soft when it sees a condoms, bringing back all the you must memories, the anxiety, the shame and the guilt, all attached with you must use a condom. In a world with as much fear-mongering, we would see a condom and say, great, I'm going to have sex. And the subconscious mind would then be triggered to ensure that we were ready for pleasure that was about to begin. There is a fix, and it's quite a simple one at that. We just need to design a condom anchor. We therefore experience the oh my god, sex is coming feeling when we see one rather than viewing it negatively. Include condoms in your month porn fast if you're going to do it, because it's the simplest method to accomplish this. This means using condoms and masturbating with a condom on every so often can be a terrific idea because it is then associating that condom with sexual feelings and sexual excitement, or preparing the body ready for sex. Invest yourself fully into it so that you can begin to shift away from the depressing anchor that the majority of us have associated with condoms and towards a joyful, sexy one that you can use to benefit you in the future. So putting it all together in therapy. So there are parts on homework which Homework is a part of the comprehensive program for treating erection problems, and these homework tasks complement the hypnotic elements of the experience. We can only effectively treat erectile dysfunctions by winning over the incredibly powerful subconscious mind. These aid the client in releasing any emotional baggage that might be impeding their progress. Being able to let go of shame and guilt enables clients to let go of the past. And this is really fantastic for moving on from sexual encounters that didn't go well. You can then release any ties to the past and any current ties to people and things in the present that may be preventing you from moving forward. This is a combination of excellent approaches and is something that clients really appreciate. And many say that after going through the process of letting go of shame and guilt, they actually feel a lot lighter. The client is then given anchors to use later on, and a technique of mental rehearsal is used to give them the impression that they have had numerous sexual interactions. So I hope this has given you a little bit more information about some sexual issues and dysfunctions that affect males, and also given you a little bit of a better understanding of how hypnosis and sexual freedom sessions run, as well as giving you some techniques and tips to try at home, such as the palm fasting and using mindfulness techniques. Thanks very much for watching. I will leave some links in the description box below if anyone wants any more information about myself or about sexual freedom therapy. If not, thanks very much for watching and see you soon. Bye bye.